I'm Dr. Sara Cross. I'm an infectious diseases physician at Regional One Health, associate professor of medicine at University of Tennessee Health Sciences Center, and I'm also a member of the Governor's Coronavirus Task Force of Tennessee. The COVID-19 pandemic is the single most important public health emergency in our lifetime. In the first year of the pandemic, we saw older patients with chronic health conditions such as diabetes and high blood pressure become very ill and many times die from this virus. In fact, over 600,000 people have died thus far. Families and loved ones have endured severe emotional and financial strain, and it is going to get worse before it gets better. In the last several weeks, we have seen a very worrisome change. The Delta variant is the predominant strain infecting Americans today. It is much more infectious and appears to cause more severe disease. Unfortunately, it is also infecting children at alarming rates. Children under 12 are not eligible for the COVID-19 vaccine yet. They are defenseless. There are currently at least 8 children in the intensive care unit at Le Bonheur Children's Hospital in downtown Memphis with COVID-19, and these numbers are sure to rise. I am not here to instill fear, but to state facts as a healthcare professional who has spent the last 11 years specializing as an infectious diseases physician. Masks are effective in preventing transmission of COVID and other viruses, and they are safe. There are no dangers to mask wearing. Carbon dioxide does not build up. Children do not learn less while wearing masks. There have already been some positive cases in schools and exposures, even with the implementation of masks. I fear for my 6-year-old daughter and for all children what will happen if masks are no longer worn in schools. Opting out of wearing masks is putting all of our children in harm's way. It is tragic that we can't be united in the fight against COVID. I am devastated that this virus has been made a political issue from the very beginning, rather than the public health crisis that it is. When people get sick, they go to the doctor or hospital. They do not go to the state capitol to get medical advice or treatment. Doctors know best how to treat medical conditions. Misinformation and politics are going to kill many innocent children if we don't do everything we can to protect them. Please speak up and fight for the children's right to go to school under the safest conditions possible, including social distancing and utilization of masks.